This is Jennifer Fisher doing asepsis preventing infection. The purpose of this class is for nursing students to gain knowledge, skills in asepsis preventing infection. The lesson objectives. The student will be able to explain the importance of infection control. The student will be able to demonstrate the chain of infection. The student will be able to describe the importance of hand hygiene. The student will be able to describe the importance of personal protective equipment, which is PPE. The student will be able to explain both standard and transmission-based precautions. Importance of infection control. Infection control, methods used to control and prevent the spread of tiny living things that are always present in the environment, however, are not visible to the naked eye. The chain of infection links. You need a cause agent. It's a pathogen or microorganism that causes disease. The reservoir, a place where a pathogen lives and grows. Portal of exit is a body opening on an infected person that allows pathogens to leave. Mode of transmission is the method of describing how a pathogen travels from one person to the next. Portal of entry, a body opening on an uninfected person that allows pathogens to enter. Susceptible host is an uninfected person who could get sick. When to wash hands. 5 moments for hand hygiene from the WHO, not the band, World Health Organization. Before resident and patient contact. In here we can give examples or stop and ask students for their feedback. Number 2, before aseptic tasks. 3, after exposure to blood and bodily fluids. 4, after resident or patient contact. 5, after contact with resident patient surroundings. And then we're going to pause. I'll skip over here and we'll play a quick video.
When you approach the sink, you can touch the faucet with your unclean hands because the faucet is considered the dirtiest object in the bathroom. Adjust the water temperature for comfort and wet your hands. Apply soap and rub all surfaces of your hands vigorously, focusing on the front and back of your hands and in between all fingers. Circle the top of your wrists as well. Friction is the key to removing all pathogens from the surface of your skin. Friction should be applied for at least 20 seconds to be effective. After washing with friction, the nails must be cleaned. Run one thumb down the length of each nail, starting at the cuticle and moving toward the end of the nail. Repeat with all fingers of both hands. Then clean under your nails by scrubbing the underside of your nails along your palm to remove debris. Carefully rinse your hands under the stream of water with your fingertips pointing downwards, taking care not to touch the inside of the sink or the faucet. Tap your fingers together to ensure that all water droplets remain in the sink. Take paper towels from the paper towel dispenser and dry all surfaces of your hands, the front, back, between your fingers, and your wrists, taking care not to allow the paper towels to touch the unwashed areas of your lower arms. Throw these paper towels directly into the trash bin. Finally, take a clean, dry paper towel to turn the faucet off, because wet paper towels may rip and recontaminate your hands.
Okay. And now here we're going to stop for 2 minutes and practice hand washing as a group, but not really for this video, so we'll skip. Types of PPE. We have gloves, gown, and mask for the standard. Caps and the hairnets are used at some points during OR, surgical procedures. And we do have a video of doning on and off the removing of the PPE. We'll skip that video. Precautions. Standard precautions. The hand hygiene, most important. The PPE. And then disposing of your contaminated equipment or supplies right away and in the proper areas. Transmission-based precautions, you have airborne, droplet, and contact. These are key terms to identify and define airborne precautions used for diseases that are transmitted through the air after expelling, bloodborne pathogens, microorganisms in human blood which can cause infection and disease in humans. The chain of infection, which we talked about, is the transmission from one person or source to another. Contact precaution, used when there's a risk for transmitting or contracting a microorganism from touching an infected object or person. So your contact precautions are for C. diff, things like that. Direct contact means you're touching an infected person or his or her secretions, bodily fluids. Standard precautions, treating all blood, bodily fluids, non-intact skin, and mucous membranes as they are infected. Droplet precautions are used when the disease-causing microorganisms does not stay airborne and only travels a short distance. So when people sneeze. Hand hygiene, hand washing with soap and water or using alcohol-based hand rub. An HAI is a health-acquired infection, usually in hospitals, healthcare settings, you can even dentist offices. Indirect contact is transmitting it without physical contact. Infection control, as we talked about earlier. Isolation means you're taking isolation of the potentially harmful microorganism and preventing spread to other people. Localized infection is an infection contained to a specific body part, thus the infection is localized. Mode of transmission, we talked about that with the chain of links. Nosocomial infection is an infection acquired in the hospital, also known as the HAI, healthcare associated infection. Pathogens are harmful microorganisms. The PPEs we talked about, as well as the portal of entry, portal of exit, and reservoir. Susceptible host. Systemic infection is an infection that occurs when pathogens enter one's bloodstream and move throughout the body, causing general symptoms. Transmission-based precautions are special precautions implemented on the basis of how the disease is spread. Summary of key points is: when in doubt, wash your hands. When in doubt, use the PPE. Infection spreads, so educate yourself and others, and it does begin with you. These are my references, and that is all. Thank you.